Today, let's discuss the summary of 2023 guidelines on the management of hypertension given by European Society of Hypertension with specific focus on beta blockers. The new report of ESH 2023 guideline includes a greater emphasis on out-of-office BP measurements, addition of potassium supplementation as a lifestyle recommendation, and gives more explicit advice for use of beta blockers as initial antihypertensive drug therapy. Increased resting heart rate is common in hypertension, in which it reflects an increased sympathetic activity. A progressive increase in resting heart rate is accompanied by progressive increase in the risk of atrial fibrillation, heart failure, and mortality, both in the general population and in hypertensive patients. Although in hypertension, the advantage of reducing heart rate is limited to post-hoc analysis of randomized clinical trials, the available evidence makes treated hypertensive patients with an increased heart rate a clinical phenotype supporting the use of beta blockers. Randomized controlled trials and meta-analyses have demonstrated that when compared with placebo, first generation and second generation beta blockers like propranolol, atenolol, and metoprolol significantly reduce the risk of stroke, heart failure, and major cardiovascular events in hypertensive patients. Beta blockers are recommended in patients with heart failure, angina, post-myocardial infarction, atrial fibrillation, or in younger hypertensive women of childbearing potential or planning pregnancy. Randomized controlled trials with carvedilol, bisoprolol, metoprolol, and nebivolol showed improved outcomes in patients with heart failure with reduced ejection fraction. In addition to their compelling use as guideline-directed medical therapy in specific disease, beta blockers exhibit favorable effects in about 50 clinical conditions, including various cardiac disease, less or not related to hypertension, other vascular conditions, and non-cardiovascular disease.